Now, I'm going to talk more about women's business. It's a very vast topic and one that needs to be talked about a lot. And I want to get a little bit more onto the nitty-gritty of women's health problems, because after a lot of years of working in clinic, these problems tend to show themselves quite a bit. So specifically I'm going to talk about UTIs, urinary tract infections. This can be a very common occurrence for many women at different ages and different stages in life, and give you just some basic tips that I've come to understand with treating this problem a lot. So I'm going to break it down into the physical component and then the emotional component, because they're very much intertwined. And I've said before in previous videos, with any health problem or disease, especially of a chronic, recurring nature, there's always going to be a combination of a physical imbalance, an emotional issue, and a mental problem somewhere. And that's why that problem will keep recurring, because it's trying to tell us something. Our body, mind and soul are trying to tell us something. So when a woman gets a UTI, what's actually happening is there's two types. So there's what I call the acid type problem and the alkaline problem. So in other words, the acid problem is when a woman's pH, the acid-alkaline balance, has become too acidic. Okay, this is the most common type of UTI that most women get, by far the most common. So in other words, if we look at it again from a natural perspective, the woman's body during, let's stay with the monthly cycle just for convenience. During the previous month, the woman's body has had to process and digest and sort things out, and it has to do that by balancing the acidity with the alkalinity. And so that means that if she's been under a lot of stress and strain, if she's under a lot of pressure, and most women nowadays with health problems are, the super mums, I call them. I feel quite a lot of compassion for women nowadays, because society puts us under huge amounts of pressure, and particularly women, because they've got to be perfect, they've got to be sexy, they've got to be cute, they've got to be loving, they've got to be a domestic engineer, they've got to be brilliant, they've got to be the perfect wife, they've got to be the perfect mother, they've got to be really good at business. So they've got to be women and men, they've got to be good at everything. And so many women carry that as a huge load in their body. So what does that do to their chemistry? It makes it too acidic. So when it gets down to, when our body's functioning, it gets down to the part where the blood's being filtered through the kidneys, and then that comes out and goes through into the bladder. Instead of it being more alkaline or balanced pH, which is the high 6s and low 7s, right, in pH, which stands for potential hydrogen as a measure, it's down into the mid 6s. So in other words, it's quite acidic. And so there's certain things that a woman needs to be aware of if that's the case and she's getting these recurring UTIs. It's because her whole system's gone too acid. So how does she remedy that? She can have alkaline things, so fluids that increase alkalinity. So bicarbonate of soda is your number one best friend. A little bit of bicarb soda. In Australia, if a woman gets a UTI, she goes to the doctor or goes to the chemist, and they give her a thing called Ural, which is essentially bicarbonate of soda. So it changes that acid situation back to alkaline. And so that helps to knock out the bacteria that are growing in her bladder that are way too acidic and causing inflammation and irritation and causing this problem of frequent urination and burning and irritation and itchiness and annoyance. And it can be very painful for many women, drives them crazy when it's at its worst. So we've got to change the bladder pH from acid back to alkaline. There is another type which is the opposite, and that's more to do with young women when they're in new relationships and they're sexually involved, and of course in a new relationship, the honeymoon phase, they want to do it lots. That's pretty normal. And so what happens is the pH of their whole system has changed. From being balanced, it's gone to alkaline. Why is that? Male sperm is very alkaline. The pH of the woman's female system is just slightly acidic. That's where it's meant to be, slightly, not too acidic, okay? But if she's having frequent sex all the time, then the pH changes because of the influence of the sperm, and so it changes that to a very alkaline state, and so then she's got a different kind of UTI, or urinary tract infection, because it's inflamed, and so she then has to take things that are more acidic in order to fix that problem. So if she's going to take vitamin C, cranberry, make sure the vitamin C is not a buffered alkaline one but an acidic one, lemon juice, lime juice, apple cider vinegar, all of those things tend to bring the pH down and make it more acidic. So if she drinks a little bit of water with lemon, squirt a lemon or lime in there, drinks lots of water to flush that through, then that will bring the pH back down to a more balanced level, and that'll kill the bacteria off. So that's what they used to call honeymoon UTIs back in the olden times. So that's a different one and a much more rare one. So a woman can always tell if she's not sure which way is it. I just say, look, just have a bit of apple cider vinegar and water, and if it gets worse, then you know you've got the acid type. You've got to go the other way. You've got to try bicarbonate of soda, and you have that, and that will reduce the acid. So that's what's going on physically. Now let's just have a brief look at the emotions, and this is something for women who get repeated cases of UTIs. I say the pH not only is out of balance in your body, but you're out of balance, and you're usually saying yes when you need to say no. So what does that mean? That means in the bedroom the woman is saying yes because of the demands of her partner, and her body's saying no, I'm not ready, I'm not comfortable, I'm not relaxed, so I'm tensing up and I'm creating acidity, and that acidity is backing up through my kidneys and into my bladder. It's also backing up through my female system, which the doorways between those two areas are so close that bacteria can move back and forward very easily. And so many women can have associated bladder problems and female system problems as well. So I usually say to the woman, it's very important that you communicate to your partner that you want to be intimate when you're ready and when it feels right to you, and say no when you need to say no. Don't give in to the demands and pressures of others around you. And that's not only in the bedroom, but that's in life. Because if women keep getting this problem, they're going acidy, they're getting irritated, they're living a life where they're under too much pressure, and the acids are building up in their bloodstream, creating all sorts of problems. So the woman's got to stop and say no more often when they're feeling under too much demands and pressure. Let their body rest, let their kidneys rebalance the bloodstream so that the acid-alkaline balance can come back to where it's meant to be, and she won't keep getting UTIs. So I hope that's helpful. And there are homeopathic remedies that I use. One of my favourites is a remedy called Cantharis, Cantharis, which is called Spanish fly. You can look it up online and go to a good homeopath if you're having that real troublesome UTI driving you crazy problem.